Hidden behind the thyroid gland are four tiny glands, the parathyroid glands. Small in size, but powerful enough to control calcium balance throughout the entire body. And the hormone responsible for this control is parathyroid hormone, also called PTH. The most important thing to remember, PTH always works to raise your blood calcium levels. Calcium and phosphate work like opposites. When calcium goes up, phosphate goes down. When calcium drops, phosphate rises. This inverse relationship is key to understanding endocrine balance. PTH increases calcium in the body in three major ways. First, the bones. PTH activates osteoclasts, pulling calcium out of the bones and into the bloodstream. Second, the kidneys. They begin to reabsorb calcium back into the blood while pushing phosphate out. And third, the intestines. PTH activates vitamin D, helping the intestines absorb more calcium from your diet. Now let's compare what happens when these glands don't work correctly. Let's start with hyperparathyroidism. In hyperparathyroidism, the parathyroid glands produce way too much PTH. This causes hypercalcemia, meaning there is too much calcium circulating in the blood. Excess calcium collects in the kidneys, forming painful kidney stones. This is the first of our stones. Bones become weak and fragile because calcium is constantly leaving the skeleton to enter the blood. High calcium slows the gastrointestinal system, causing constipation, nausea, and abdominal groans. Patients may also experience psychiatric moans, becoming tired, depressed, and lethargic. On an ECG, hypercalcemia shortens the QT interval. This is a critical sign for nurses to monitor. For nursing interventions, hydration is your top priority. Administering normal saline is vital. Hydration helps dilute the calcium and flush it through the kidneys to prevent stone formation. Encourage mobility and weight-bearing activity. This helps keep the calcium inside the bones where it belongs. Educate the patient to avoid high-calcium foods like dairy products and dark leafy greens. Never give thiazide diuretics, because they actually increase calcium retention in the body. Instead, loop diuretics like Lasix may be used after hydration to help remove excess calcium. Medications like cinacalcet and calcitonin can help lower calcium levels and protect the bone density. Now let's switch to hypoparathyroidism, where there is simply not enough PTH. This leads to hypocalcemia, dangerously low calcium levels that make the body hyperexcitable. Low calcium makes nerves and muscles extremely excitable. This leads to tetany and spasms. A positive Trousseau sign causes a distinct carpopetal spasm when a blood pressure cuff is inflated. A positive Chvostek sign causes facial twitching after tapping the facial nerve. Watch for numbness and tingling, also called paresthesia, around the mouth, fingers, and toes. The most dangerous complication of low calcium is an airway spasm. This is a medical emergency. Laryngospasm can suddenly block the airway. It is life-threatening and requires immediate action. Always keep emergency airway equipment nearby after any thyroid or neck surgery. Hypocalcemia prolongs the QT interval, which can trigger deadly ventricular dysrhythmias. Severe cases require slow IV calcium gluconate. Remember, it must be administered slowly. Monitor the IV site closely. Calcium can severely damage tissue if it leaks out of the vein. Patients need a high calcium, low phosphorus diet to maintain safe levels long term. Implement seizure precautions. The neuromuscular excitability makes the patient high risk. Let's summarize the differences simply. Memory is key for the NClEX. Too much PTH makes the body slow, weak, and overloaded with calcium. Think stones and groans. Too little PTH makes nerves hyperactive, causing spasms, tetany, and critical airway danger. When you understand calcium, you understand the parathyroid glands. Master this, and the NClEX becomes much easier.